Hello, everyone. This is Lauren Davidson, the Program Director at UC Davis. I'm not presenting tonight, our residents are, but I just wanted to thank everyone for staying on this late, especially the East Coasters, and hopefully we can entice you to come visit us at UC Davis.
All right, thanks, Dr. Davidson. Hi, everybody. My name is Brandon. I'm one of the PGY2s at Davis, and then we have Dana and Gabe are also on. If at any point during my presentation you guys have any questions, you can pop them in the chat box, and they'll try their best to answer them for you. So let me pull up our slides here. All right. Everybody able to see those okay? All right, so we are located in Sacramento, California. This is our residency program here. And you can see kind of all 9 of us right now, and Dr. Davidson. Our current program leadership is Dr. Davidson, our program director, and then Dr. Vandenacker on your right. She was the program director for several years until recently. Dr. Davidson is taking the helm, but Dr. V is still around handling most of, we're just kind of helping with the transition period, and she's still on as faculty doing a lot of work with our all of the residents in clinics. And here's the rest of the faculty. Won't go into too much, but we've got a pretty diverse group and a lot of different specialists and generalists, and so people that have been around at UC Davis for a long time, and obviously it's a great place to work and to be. And I myself grew up in Davis and went there for undergrad and decided to come back for residency. This is our current residence. There are currently 3 of us per year, and then there are 2 categorical positions and 1 advanced position. Starting with the class that just started as PGY1s, you can see Mitch and Jared there at the bottom. We now will have 4 residents per year with some recent expansion, so there will be 2 categorical spots and 2 advanced spots. And we have a little bit more information about the residents. If you want to get to know everybody a little bit more, if you click on everybody's name on the website, the link there below, you can see a little bit more about what everybody likes to do, etc. Going through our rotation schedule, one of the things that I think is kind of unique about UC Davis is that we do not have a super heavy inpatient heavy PGY2 year. A lot of places start with a big heavy a lot of inpatient during that period, but if you look at PGY2 here, only 4 months of PM&R wards that year, and then kind of mix in some outpatient clinics and pediatrics and some offsite rotation at Mercy. So you get a pretty good breadth of experience during that time period. And so if you're considering a subspecialty, or if you don't even know what you want to do yet, that'll give you the opportunity to kind of explore all the different subspecialties of PM&R if you're thinking about potentially going into a fellowship there. Here's kind of what a sample one would look like. A lot of basically alternating 1 and 2 month rotations for the first year or first and second year, and then mostly 1 month cycles as a 4th year. And then you can see what the PGY1 year looks like. I'm not going to stay on here too long, but pretty much all of this information is available on our website, which I'll link at the end of the presentation as well. So you can take it at your own pace later. And kind of over here is just a little bit of breakdown of what's included in each one. In those clinics, we get plenty of procedural experience, EMGs, no problem meeting the minimum requirements. And then same thing with sports and all of the injections there. I'm pretty sure I hit my requirement for the ACGME for joint injections within the first about 6 weeks of my MSK rotation as a PGY2. And then kind of all the other ones, including a continuity clinic once you start as a PGY4 as well. I'm kind of just going to briefly skim through all of the different clinics, mostly just pictures here of who's in charge of everything. One of UC Davis's greatest strengths is our neuromuscular disease and our pediatric programs. I'll talk about the fellowships here shortly, but this is Dr. McDonald, who's our department chair, and then Dr. Joyce and Dr. Williams are all great to work with both in clinic and as research mentors as well. We get to do some EMG clinics and workshops. We have EMG is very incorporated into our curriculum. This is Brent, one of our recent graduates from residency, obviously getting some, actually becoming a guinea pig here. Going into our spinal cord injury, Dr. Zhao is our spinal cord specialist. We get plenty of experience with patients at all different levels, all different abilities. UC Davis is a level 1 trauma center, and so we get quite a bit and working with our neurosurgery and orthopedic spine colleagues as well, both on the inpatient rehab side and then in some of our outpatient spine clinics. ALS is another clinic that is multidisciplinary here, and patients get a lot of attention and a lot of different modalities and providers that are providing them with some assistance. We do spasticity management, baclofen pump management. We have a great amputee rehab program both at UC Davis and over at the VA, which the VA is obviously a great place to work for working with patients with amputations and prosthetics. Dr. Zhao does some acupuncture as well, so especially over at the VA, you can kind of get to some experience with that if you're interested. And then we get to rotate at Shriners, which is a wonderful experience. Working with all the kiddos there, you get to see, I think, Halloween there at the bottom of the screen. And then we get some pediatric spinal cord injury, spina bifida, cerebral palsy, all of these things with the different pediatric specialists. And then the pediatric amputee clinic is a great multidisciplinary clinic with Dr. Arsenault. And then also we work with very closely with the orthopedics team over at Shriners, as well as with the prosthetics and orthotics specialists. And then some adaptive sports, as you can see at the top there. Some brachial plexus injury, pediatric sports medicine with Dr. Ingwerson, and then we have our C Street clinic, which includes the sports and spine programs here. And we have multiple different providers here. Your top right is Dr. Davis, and then top left is Dr. Waite. Both have extensive experience both in the United States and internationally, covering multiple different sports. Then you have Dr. Foston, who covers USA Gymnastics, and then in the bottom left corner is Dr. Jeremiah Ray, who's actually emergency medicine trained, and he's the head team physician for all of the UC Davis Division I sports as well. So plenty of opportunities. And then bottom right corner, the California International Marathon, which is the last qualifying marathon for the Boston Marathon, and we get to work on that in terms of coverage, which is an amazing experience. We have our spine program with Dr. V and Dr. Shin, different, mostly non-op. One of the cool things about our spine program is it's in the same room. We have a large room with the neurosurgery and orthopedic spine specialists, and so you have the opportunity to kind of go back and forth. You can just curbside folks, or if you need to send somebody in for a quick surgical referral, it's easy to get them over there, which is wonderful. Dr. V is one of the most renowned post-polio specialists on the West Coast. We have patients coming from Alaska, Montana, all over the place to come meet with her for kind of post-polio, and that's one unique experience that we get here at UC Davis. We have our inpatient rehab team. We're kind of working on a new inpatient rehab center, which we'll talk about here in a minute. We got Dr. Dorsett and Dr. Newdorf, and obviously we like to have a good time here on our inpatient service. Here's our brand new rehab hospital that is anticipated to be done in 2023. That'll be a 40-bed new hospital, and we're bringing on a couple of new additional faculty to help accommodate with that. We have some experience at the VA with Dr. Shin and Dr. Hovez, and some interventional procedures there as well. We get to do an occupational medicine rotation at Kaiser with Michelle, who's a recent UCD alum as well, and then rotating at Mercy. Again, you can see here a lot of UCD alumni like to stick around at UC Davis and in the surrounding area. People really like to live here in Sacramento and the experiences and opportunities that it provides. Just some kind of information on the didactics, all kinds of different things, pretty standard here. We rotate with our didactics every 12 months. So during your residency, you'll get everything 3 times. I've found, and even in just some of the experiences that I had when I was here as a medical student and coming back, and I'm sure that the 3rd and 4th year residents will say the same thing. You learn something different every time you see it. And then as you go through it, a lot of times the senior residents will take more of a teaching role in some of our smaller workshop sessions. So you take it from a different angle, gives you a different experience, and helps you learn something new each time, and prepares you for also that life after residency as well. We have predicted time for our didactics weekly on Tuesdays, and then journal club case conferences, grand rounds on Thursdays. Some resident didactics here. You'll see Gabe rolling down the hallway in a wheelchair. We're learning to do some wheelchair mobility in one of our didactic sessions. And then just kind of everybody listening intently here. And then every once in a while, we like to have a little good time, and Gabe and Jorge just doing a little jam session in the team room there. Just kind of some other things, in just working on transfers and some OMM here from Dr. Newdorf, who was a recent graduate and now an attending here. Call schedule, 9 weeks of calls as a PGY2, 6 weeks as a PGY3, and 3 weeks as a PGY4. Everything is home call except for when you're on for the weekends or the holidays. You come in and round, and then see some consults, and then after that, everything is from home. We have some experience with adaptive sports, including some lectures and some volunteer opportunities. There's plenty of research going on in all different areas, especially, you know, some neuromuscular disease is pretty robust here in this department. But whatever your interest is, you can find something, and many of our residents and fellows will go present at conferences here as well. We have 3 accredited fellowships within the PM&R department. There's sports medicine, pediatric rehabilitation, which is a brand new fellowship for us this year. And then the neuromuscular and electrodiagnostic medicine, which as far as I'm aware is the only NMD fellowship within a PM&R department in the United States. A lot of things that we like here while living in Sacramento. It is California. The weather is great a lot of the time. It gets a little hot in the summer, not that cold in the winter. Some sports here, Sacramento Republic FC, planning on becoming actually an MLS team here in a couple of years. You've got the Sacramento Zoo, you got the City of Trees, Farm to Fork Capital, and a link for if you're looking for more reasons to live here. You got Lake Tahoe and all kinds of outdoors activities around here. Yosemite is 3.5 hours from here. The Eastern Sierras are 5. You can get to the Bay. San Francisco is 1.5 hours to 2 hours. The coast, you got Muir Woods, all kinds of different things here. You got the Point Reyes and all different places. And then our residents here, one of the things that is why I picked UC Davis is the people here are amazing. We have such a close-knit group of residents and faculty. Many of the faculty are on first-name basis with a lot of the residents, which I find it just makes it so much more comfortable. It's great on a daily basis when you're working with people that you spend time with outside of work. Obviously, all of this stuff is pre-COVID, and we're a little bit limited, but hopefully we can get back to a lot of these things here soon. But you can see, like to have a good time, outdoors, indoor things like to do. Dr. Wade always likes to get together for Zumba, a little holiday party, some hikes, some ice cream, all kinds of different things. I want to give you guys a chance to ask some questions, but you know, some of the reasons that I chose UC Davis I talked about already, but we get a good diverse exposure. There's excellent exposure in NMD and sports medicine and EMGs. I felt like everything that when I was looking at programs, it checked all the boxes for everything, and people have gone on to go do fellowship or gone straight into practice, both in academic medicine or in private practice. So I didn't feel like they were missing anything, and just the feel of all of the people here was something that I didn't get as much of in any other places. So we got a couple things here, so we can just kind of, this is us socially distancing for a photo. And then here's our contact information. We are now on Twitter and Instagram, and here's our website at the bottom. And then if you have any questions about logistics, you can email our program coordinator, Debbie Duckett. She is amazing and will help hook you up with the right people to get in contact with. Now we have time, I think, for a few minutes worth of questions, either in the chat box or over the mic. In terms of mentorship programs, yes, every resident gets assigned a faculty mentor at the very beginning, but you know that you're not restricted to that mentor. A lot of people have multiple mentors for different things. Usually you get assigned a mentor, and you basically follow up with them pretty regularly. And then if you're working on any research projects and or anything else, even just career advice and something more subspecialized that you want to go into, I would say that you have plenty of opportunities. And like I said, one of the the things I like the most about UC Davis is how close everybody is here. And I've had no problems with, you just walking up to somebody and asking, hey, like, I'm interested in a research project or I had a question about this, and everybody is super open door about that stuff. Next question was...
You got 5 minutes left. 5 minutes.
Oh, wonderful. All right. What opportunities are available for residents to be involved in medical education? So we have quite a few different things. One, we have medical students rotating all the time, both on our inpatient and outpatient rotations. There is a PM&R interest group that many of the residents get involved with, and helping, kind of guide people towards PM&R. And then also, we usually, I think, the folks at UCLA had mentioned something about doing physical exam workshops, and we do a very similar thing up here. And I think they just sent out an email today about coordinating them for doing like some ones over Zoom to, doing like very individualized and very small group things to try to teach folks the physical exam while minimizing all of our exposure risk. And as PM&R residents, we're definitely getting involved in coordinating that. So and that's one of my favorite things as well too. You're at an academic institution, and so you have plenty of that. And both residents rotating, or both medical students interested in PM&R, as well as any folks that are people that are going into other specialties that just want to learn about the specialty, and they can also offer us, some other perspective from that. Other things, maybe Dana or Gabe, if you guys have anything else to add. I know I've talked quite a bit and quite quickly, just trying to rip through anything. If you guys have anything else to add.
You've done a great job, Brandon. I just wanted to add, for teaching, there's also many student-run clinics. In particular, I've helped out a number of times at one called Paul Hom Clinic, and they have MSK days once a month, but you could come in anytime and also get like more primary care experience. But it's a good chance to teach medical students and kind of realize what you've learned.
Yeah, and then let's see, we've got a question that asks about the general patient population. Sacramento is one of the most diverse cities in the country. You get a pretty wide mix of things. You get people that have quite a bit of poverty and many medical comorbidities and poor health literacy, ranging from people that are doing quite well and are very educated, and so you get all kinds of different experiences with that. In terms of volunteering with the underserved populations, I'm sure there are plenty of opportunities. I have not experienced anything myself, other than I know Dana just mentioned the Paul Hom Clinic is a perfect example, and there's many other student-run clinics that are all free for the community members. But I'm sure that there's plenty of other things involved. There's a lot of, like any kind of major metropolitan city, there's plenty of things to be done to help out other folks that are in need.
And also Shriners Hospital for children, that's such a wonderful experience. And kids come all the time from Mexico and other places without any insurance, and because of the funding they have, we're able to take care of so many kids. So that's another way.
You got 2 minutes left.
All right. Any other questions? If not, let's see, anything else we'd like to highlight?
Yes, I believe that is all for rehab. And I'm going to put my email in the chat if you guys have any questions.
Hospital admin or leadership opportunities. Dana, anything you know of for that?
I guess, like the resident medical staff committee, there's that. There are other committees. I just haven't been as involved personally, but there are those opportunities.
Yeah, there's ample opportunities. Our residents serve on the resident wellness committee, the resident house staff committee. Like many of the UCs, we are in the process of having the residents be represented by unions. So we have a representative from our residency class serving there. So there's plenty of opportunities for leadership and admin if that strikes your fancy.
All right. Well, thanks everybody for having us, and thanks for listening. If anybody has any other questions, feel free to reach out, and our website as well as our social media account will kind of be a good resource for some of the things that we have here in the presentation as well.